Hi friends, welcome to my channel. I am describing about waddling gait today. You would have seen some people walking to the body turning to swaying to each side. On each step they put forward, body turn to one side, and the next step the body turn to other side. This is called duck walking or also called as waddling gait. This waddling gait is described for hip problems initially, for the weakness of the abductor muscles, which is mainly responsible for lifting the leg to the in the air and keeping it front. However, we are seeing this kind of waddling gait in the knee patients whenever they have this bow type of deformity due to severe and advanced osteoarthritis. When they come for osteoarthritis problem, we will be seeing them walking like this. So the causes of this waddling gait or duck walking is bowing of both the legs due to advanced osteoarthritis with stiffness of the knees and weakness of muscles around the knees. Because of all this combination of all these problems, all these issues, they will be walking like this. And they ask this question when they are due for knee surgery. They will be interested in knowing if this waddling gait improves after they undergo this procedure of knee replacement. My answer would be yes, 100% this waddling gait will be treatable after the surgery. This will be disappear when you walk properly after the knee surgery. The main reasons when this waddling gait disappears is when the alignment of the leg is corrected, when the range of movement of the knee is improved, when the muscles around the knee get stronger due to exercises, when all these three things are taken care, and then when proper physiotherapy and strengthening of the muscles are done after surgery, when they try to walk with conscious effort, walk straight without swaying to each of the sides, definitely this can be treated. And it is not like it's not like a problem to treat, but then this can be made to walk. They can be made to walk straight, and this problem can be solved. When they undergo the procedure of knee replacement and the knees are made straight, when they start walking without support, first 1 to 2 months they may not be able to appreciate the improvement, but after that 3-4 months later they have to walk with a parallel bar walking or gait training, and they have to walk in front of the mirror. Supposedly, if they have to appreciate that if their body is not swaying on each side when they are walking, and on regular practice they will be able to walk straight. But it takes time, 2 to 3 months for the after surgery, and continuous effort from the side of the person involved. They have to put efforts to strengthen the muscles, to improve the range of movement, and then of course the leg alignment would have been made straight with the surgery. So this is about the waddling gait, and that is also called as duck walking. Definitely there is a cure for this, and you can get rid of it. Thank you.